Ever wondered why the aortic heart valve sometimes narrows and causes a condition known as aortic stenosis? This intriguing question leads us into an exploration of the causes and pathophysiology of aortic heart valve stenosis. The story of aortic stenosis begins with the heart, which, as you may know, is a muscular organ that pumps blood throughout the body. The aortic valve, located between the left ventricle and the aorta, plays a crucial role in this process. It opens to allow blood to flow from the left ventricle into the aorta, and then closes to prevent blood from flowing back into the ventricle. Imagine a door that's become too narrow for people to pass through. That's what happens in aortic stenosis. The aortic valve becomes narrowed or obstructed, making it harder for the heart to pump blood into the aorta. This can occur for several reasons. One primary cause is age-related calcific aortic stenosis. Over time, calcium deposits can build up on the aortic valve, causing it to stiffen and narrow. Rheumatic heart disease, a complication of strep throat or scarlet fever, can also lead to aortic stenosis. In this disease, the body's immune response can damage the aortic valve, causing it to become inflamed and eventually narrow. Congenital heart defects, such as a bicuspid aortic valve, can also cause aortic stenosis. Normally, the aortic valve has 3 small flaps or leaflets that open and close to regulate blood flow. But in a bicuspid aortic valve, there are only 2 leaflets, which can make the valve more susceptible to stenosis. Now, let's delve into the pathophysiology of aortic stenosis. As the aortic valve narrows, the left ventricle must work harder to pump blood into the aorta. Over time, this extra work can cause the ventricular wall to thicken, a condition known as left ventricular hypertrophy. This increased workload also affects the pressure-volume relationship in the heart. In a healthy heart, as the volume of blood in the ventricle increases, so does the pressure, allowing the heart to pump blood more forcefully. But in aortic stenosis, because the narrowed valve restricts blood flow, the pressure in the left ventricle can become much higher than the pressure in the aorta, even when the volume of blood is the same. This is reflected on a pressure-volume curve as a shift to the left, indicating increased pressure for any given volume of blood. In summary, aortic heart valve stenosis is a condition where the aortic valve narrows, making it harder for the heart to pump blood into the aorta. This can be caused by age-related calcification, rheumatic heart disease, or congenital heart defects. The increased workload on the heart can lead to left ventricular hypertrophy and a shift in the pressure-volume curve to the left. Understanding these concepts can provide valuable insights into the diagnosis and treatment of aortic stenosis.